It's on top of mind for everybody for sure. You know, with the state of emergency having ended, and without a new executive order, our guidance really remains steady and the same around ensuring health and safety for sure, but continuing to allow in-person gatherings of for our participants in programs and the population overall. So how we're approaching it at Dale, as we talk with providers, is to say we're approaching it with an abundance of caution, encouraging masking for everyone at this point when indoors, encouraging as much outdoor gathering as possible as we head into fall, encouraging, you know, the continuation of health and safety protocols, hand washing, sanitizing, cleaning, all of those things that we've been doing for the last year and a half. But there's no mandate at this point for those particular things. So that's basically where things are at. Our staff are out in the community doing clinical assessments in people's homes. They're receiving that same guidance to really be cautious, be careful, be safe, follow the health protocols, and we'll get through this surge. The good news is that, you know, vaccinations really are a great protection. Even with the Delta variant, we're seeing very, very small percentage of people landing with serious illness, hospitalization, or death if already vaccinated. So still really encouraging that among the population. And what the other good news, of course, is that, you know, for older Vermonters, 95% of folks are vaccinated. So that's, we're really, you know, grateful for that. And just hope that continues. I can say that I think booster shots are coming down the pikes, beginning with people in long-term care facilities, so nursing homes, assisted living homes, residential care homes, towards the end of September. So the preparation for beginning booster shots for 8 months out from the time that people received their initial shots. That preparation at the Department of Health with some Dale support has already begun in terms of reaching out to facilities and getting them prepared to be able to do that. So they'll start there, and then it'll work its way out to the general population over the coming months. So that's on the horizon, and I anticipate we'll be able to share more, and you'll hear more from the health department as well in the coming week. So I'm going to pause there before going into any other updates to see if anyone has any questions about what I just shared.
It's not a question so much. I'm sure other people other than myself, my husband is a transplant patient, and at the doctor's yesterday, they said that he should not consider a third shot as a booster. It should be part of his original series. So he went for his third shot yesterday, and it has not been 8 months since his second shot. And they said anytime after 28 days, you could get that third shot for those people that are on immunosuppressants and transplant patients. But it's not considered a booster for those. So other people, I mean, I'm sure obviously that likelihood of transplant goes up with age. So I'm sure I'm not the only one who knows someone who's had a transplant. If people have that question, it's worth bringing up.
Yeah, that is true. Thanks for bringing that up, Carrie. There is that cohort of folks who are immunocompromised, immunosuppressant. There's a cohort of folks who have been able to get an additional shot even before we move into this next phase for a larger group. So if you know anyone, if you're getting questions about that from anyone that you work with, I would definitely just tell them to really consult with their healthcare provider, who should have the most information about if they fit into that category and what to do. Okay.
I have another quick question about that too. So is the guidance, or will it be through the same methods as the vaccines before, or will people be able to get it through their doctor's office, or do we know anything about that?
It's not quite clear to me yet. I don't think all of the logistics and operational piece has been put together. My understanding is that there's going to be a combination of ways that people will be able to get the next shot. There may be mass vaccination sites as there were in the past, but it may also be through pharmacies and health and primary care providers as well, depending.
Okay, good.
So again, I think we'll learn more. Like it's in development right now, so there will be more information coming soon.
Thank you. We are getting those questions already, and so it's really helpful to be able to know how to answer. Even like a handout or something at some point would be fabulous.
I have a question. I'm Kathy Baker from Danville Mill Site. So mask for all indoors, how does that apply to eating? And is there still a recommendation about spacing 6 feet and no touching of common surfaces? A lot of our seniors were helping themselves to their coffee and soup and whatever. We are presently closed as of August 12th because of the Delta variant and concerns about trying to orchestrate all of those. But I didn't know what the state recommends in terms of just eating. How does one eat with a mask and so on?
Right. So the recommendation at this point is to mask. So there's no mandate to mask indoors. There is. It was just yesterday in the governor's press conference that the Commissioner Levine of the Department of Health spoke to masking indoors for people who are vaccinated, and basically highly encouraged it when you're in a large setting or people's vaccination status is unknown. It's still a personal choice for people who are vaccinated, but it's highly encouraged. So that's how we're approaching it. In terms of a meal site or a congregate meal, again, people are encouraged to mask, but are allowed to eat in a group. That is okay. That's allowable. And how you want, I know it's been a little delicate in terms of trying to set up spaces that work. We've been on the honor system for people coming in, and hopefully all those who might be unvaccinated. I mean, I would encourage folks if you have folks to just always be offering a takeout option for people, if that's possible at your site, to then be able to offer a meal in a way that could be safe for those who might not be unvaccinated for whatever reason. So that's pretty much where it stands at this point. But each individual center, you have the ability to close if you feel that you need to do that. I would love for us at the SUA to be able to know if there's a lot of sites that end up doing that, but I do think you can stay open and continue to serve people just following the health and safety protocols that have been in place.
What about the touching of common surfaces? That shouldn't be happening? Or?
I don't believe that there's any change in the recommendations around surfaces. They haven't been shown to spread the virus in the same way that it's spread through the air. That said, having really good cleaning practices is recommended, but there is no there's no requirement around common surfaces in particular. If people need more nuanced guidance for your particular site, I can definitely connect you with someone from the Department of Health if you want more of, if you have more specific questions about like the cleaning at your center. But for the most part, the recommendations are what the CDC recommends around cleaning. Okay, just a couple other updates from my end as well. At this point, do we have anyone from, no, we don't, from the area agencies on aging on the call? I don't see anyone. The 5 area agencies on aging have submitted their area plans to Dale for review and approval. These are 4-year plans that outline the regional goals and objectives and strategies for addressing the Older Americans Act work and the older population in their service area. So hopefully you have been a part of that process in, in being able to provide input into the area plan of the area agency on aging that you work with. But if not, those plans should be available after they're approved by the Commissioner of Dale in the coming months. And the reason these plans are important is they then allow the AAAs to receive the Older Americans Act funding that supports things like congregate and home delivered meals. So it's sort of the mechanism that we use to ensure that the funding is used as it's designed. In addition, the AAAs also just received the American Rescue Plan funding that was that the American Rescue Plan passed in the spring, and it included specific funding for Older Americans Act programs. So meals, supportive services, family caregiver support, those kinds of things. That it took quite a while for the system to be able to get that funding actually to the AAAs. So they've received those what are called resource projections, and they're then able to adjust budgets and begin to draw down that additional funding that came from the American Rescue Plan. So if you have particular needs in your center, whether it be related to meals or other supports for the senior center, reach out to your AAAs. There may be an opportunity to use some of that additional ARPA funds to support some of the things that you're working on in collaboration with the AAA. So that's where that funding piece is at. I will have to we'll have to follow up with Connor to find out the status of the senior center survey, or maybe Deanna, maybe he's touched base with you about that to be able to give an update. I haven't been as directly involved, but I know that that was another thing that has been in the works this summer.
That's a quick answer. He said that as of today, there were 37 responses received out of roughly 45 of us. There is one that he knows of that's still going to submit it, which will bring it to 38. So it's still open. If any of you would like to complete the senior center survey, it'll give us more comprehensive information about what senior centers are doing and help us with advocacy. We'd really like all 45 senior centers to participate so we have really accurate data. There's some questions added about funding that are really important. And of course, just numbers of people served and what you're doing. So if this is my final plug, we're not making any more phone calls or bothersome emails, but if you happen to be one of the last 6 or 7 that haven't done it, that's still open. We'd love to have your input. Your voice is so important. So, and thank you to all the rest that have. It's really, really important. They're hoping to get the report out in September, which is Senior Center Month, and that will help us with the work that we're doing promoting senior centers. So I think that's the survey update.
Great, thank you. I just thought of one more update to share. It's not really an update. It's more of just to put this on your radar for your advocacy efforts. I learned that there's a new bill in the Senate, in the Senate Help Committee called the Home Meals Act. I'll put the link to it in the chat after I'm done talking, but it's specifically to amend the Older Americans Act to provide funding and the ability to pay for vehicles that are equipped to transport both hot and cold meals over a distance. So it's designed to really increase the capacity of meal providers in terms of delivering meals and provide some designated funding to be able to do that. So it would add that on to the Older Americans Act. It was introduced in the Senate by Senator Joe Manchin of West Virginia and Senator Susan Collins of Maine. And it's now was referred to the Senate Help Committee, which our Senator Bernie Sanders is a member of. So if, and when you're thinking about advocacy at the federal level, that could be something to look at for sure.
And do you know, I've read a couple of updates from Meals on Wheels America about increased Older Americans Act funding. Has that been approved yet, or is that?
No, there's been a few things introduced, I think. Don't quote me on it, but in Congress to permanently increase the Older Americans Act funding based on the COVID funding that has come in. I don't think that anything has come through for anything has passed quite yet. It's definitely a discussion topic at the federal level.
Okay. And I have one other question about something you said previously, the 5 area plans on aging. Is that something, should we reach out to our AAAs and get a copy of them even as a draft if they're, and I think we talked at a previous meeting, at one of these meetings, maybe having the AAAs present the goals that relate to the work that we do so that we could understand as a group collectively those goals that are related to nutrition and some other things. I don't know what they are, but I would like to see them and think it'd be a good idea to have them shared broadly.
Yes, and you can definitely reach out to your AAA and ask if they can share their area plan with you. I don't see any reason why they wouldn't be able to do that. And they did create collaborative shared goals across all 5 AAAs for the area plan. So I think that's a great idea to have a presentation about that so everybody could learn.
Oh, good. And I see Kathy just joined us. So your timing is impeccable. Could we put you on the agenda? I think you'd probably be the best one to do it, Kathy, or maybe you and another person together. If you'd like to share with this group the area plans on aging goals related to nutrition.
Yes. Yeah,
Okay.
we can have there'll be a team of us.
Okay. So
thank you for letting me know what I'm saying yes to, but yes. Sorry, I'm late. That's what happens when you're late, right?
It had come up. It had come up at a previous meeting, I think, when they were more in draft form, that we'd like to discuss them as a group or understand the goals for nutrition that relate to us. So I think That'd be a great topic for next month, if it's timely for you guys.
Sure. And what date would that be, Deanna?
We've switched to the first Wednesday of the month at 2. We used to be the third Friday, but there was quite a few conflicts for that. So we're now trying the first Wednesday at 2.
Okay.
And unless we get a lot of feedback, we'll leave it that and see how it works for, a while. Till we come up with something better.
Cool.
May I ask a question?
Of course.
Thanks. Angela, could you just either repeat exactly what you said or just reaffirm what I think I heard about the Home Meals Act? You said it's specifically amended to the Older Americans Act, and there's a possibility it will pay for vehicles. Is that what I heard?
Yes, that's what you heard. It's been introduced in the Senate, so it's not a bill that has passed. It's not law. It's a bill that's been introduced in the Senate. I'll find the specific number so you could actually read the language of the bill, but it's called for short, the Home Meals Act, and it's designed to help pay for transportation to support the delivery of both hot and cold meals, whether they're being delivered to a congregate site or to homes.
Thanks. So I guess it's still in the development.
So the bill was introduced in the Senate, so that the language is there. You can read what it's proposing to do. It's been referred to a committee, right? It's the Help Committee, and the Help Committee would then have to pass it out of committee in order for it to then be addressed by the full Senate. Then the full Senate would have to vote. Then it would have to go to the House and pass there as well. So there's kind of a long road towards passage, right? But the fact that it's even been introduced is pretty is important, because it's recognizing the importance of these programs and the need to really invest in being able to reach people, especially in rural areas where we have to drive a long way to get meals out to folks.
Yeah. So if I read all of that, it's available on the internet. So that like my thought is, does the senior centers who deliver meals would have one car for the route, or is it the individual cars that the drivers themselves own?
I believe it creates a competitive grant process so that you would how it would actually actualize in a state, but remains to be seen. And of course, the bill can change between introduction and actual passage. It can be modified along the way. So no guarantees that what you see today will be what comes out the door on the other end. But the intention is to be able to for meal providers to be able to apply for funding to pay for some of it.
And that's not COVID related. That's a separate that if that act does get all the way through the legislation all the way, then it's a permanent thing.
It would be
law. It's not affiliated to the COVID time period. Okay,
no.
Thanks.
So just a caution that would open it up to be a competitive grant so that anybody who is making meals could apply for that, because that last mile is always the challenge for a lot of new people. And so that would, you already do that, but, and you manage how you manage, but yes, it is difficult. Some of you have to hire people to do it, but it also allows other providers to come in and get this grant and then provide that last mile. It is just the pros and the cons, right?
The other, just a side note about meals and vehicles, and if you're a member of the Meals on Wheels Association or Meals on Wheels America, you know this already probably, but they have a really fabulous relationship with Subaru, and you can get a vehicle. If you buy a Subaru vehicle, you can apply through their website to get a no negotiating manufacturer costs Subaru, which is really great. We've done it twice now for vehicles. It can be a vehicle for your center to use at your center for your own purposes related to meals and delivery and transportation, or it can be a Meals on Wheels employee, a staff person, or something like that. So it's a pretty good deal for just getting a vehicle for one. And then certainly they have grants and other things through Meals on Wheels America. Our Subaru that we have, we've also sponsored, and so we put stickers on it from other businesses who want to support Meals on Wheels and transportation, and that helps us pay for that vehicle. Just as other ideas to throw out there. Thank you for that.
Can I? So I just had a question for Angela. About 2 days ago, it was announced that adult day centers are getting 5 million from, or what was it? I'm reading right here. Adult day centers in Vermont are going to be receiving 5 million in federal assistance. And I didn't know if we were grouped in, if we could be, or if this is new funding, or if we've already talked about this that is presented in a different way. It does mention Dale. The money is being distributed through Dale and allocated in 2022.
Yes, this was funding that the legislature specifically appropriated for using COVID ARPA funds, the American Rescue Plan funds, to support adult days coming out of the pandemic, reopening, because reopening and readjusting. Most adult days are still serving only about 50% of the folks that they were serving pre-pandemic. So they're still operating at a loss for the most part. So the legislature appropriated this funding specifically for adult days, and just for this state fiscal year. So that's what that funding is for.
Okay, I knew it would be a reach, but I didn't know if we were kind of clustered or could be.
Unfortunately, there isn't any wiggle room at this point.
I think that's a great question and an important point to make that should be on all of our minds. Adult day programs have a lobbyist, and they can advocate for that kind of funding. They have an association with membership dues where they advocate together, and their funding goes directly to them and not through other sources. So senior centers have none of those things. We don't have a lobbyist. Our association doesn't have a staff person or the formal setting. That's one of the things we've talked over the last several months, and part of the grant that we applied for through the Bernie grant, to have a staff person, a paid person to run this network, this association, so that we can have a better voice together and help us, begin to lobby for that kind of support. Adult days have had really significant direct funding throughout COVID. This isn't the first. I was on the board of an adult day program that was closed, but received significant funding to keep going. And it is, it's kind of hard to take sometimes as a senior center when you're open and still serving and considered essential services and getting almost no federal, funding like that to keep going. We're still fighting and fundraising and doing all of those things that we're doing, and we're running and still serving all those people. I think.
What's the status of this position? I know the Bernie money came through, or the federal money.
Well, that's the part of my update for VASCAMP. It's still pending. It's still out there. There's a request for all of the aging services request It's under Age Well's name. Age Well would be the fiscal sponsor for all of those projects, and it still includes the request for the VASCAMP position to establish VASCAMP as a 501c3 and that staff person. It also includes the joint request that we all would be able to apply for as individual centers for wellness related type grants, foot clinics, fall prevention, exercise, any of those kind of things that we talked about previously. And it also includes the AAA request for food bags for seniors that would go out to people on Meals on Wheels. And so all of that's under the one grant. It's still listed on the website. The last status update we had from Bernie Sanders' team is that it's still in consideration. It made it through the first round, and that's all we know. But it's out there on their website listed under Age Well. So that's my update for VASCAMP. That's really it. Otherwise, I'm just we do have a change in our well, Jana's not on the phone today, although she's the co-chair of the steering committee, along with a few others on this call that serve on our volunteer steering committee. But Jana's position has changed, and she's no longer the director of the Montpelier Senior Activity Center. She's still there in a different capacity and still will be engaged. But Sarah Lipton is taking her position as the director of the Montpelier Senior Activity Center. So that's an update from them. Let's open it up for all updates from anywhere. I really appreciated the email chain this month and hearing what was going on with everyone, but let's bring up do any Q&A or brainstorming. And I'd also love to hear what anyone is doing to celebrate Senior Center Month, if you'd like to share, or any successes or challenges. Beth, how's it going?
Well, I guess we do have a big success through Age Well. We were granted, Age Well in the city of Burlington granted us money to buy a handicap accessible bus. And we took our first trip to the fair yesterday. We did we could have filled the bus 5 times, but we have a full calendar with grocery shopping trips and social trips going. And it's pretty exciting, and it's gaining lots of ground. So we're also open. We're open like regular times. We did ask everyone when they're walking around to wear a mask, but they can take it off when they're playing bingo or doing Tai Chi or yoga, but we are fully open inside and out as well.
Danville just had one of the few volunteer appreciation lunches. We get all the volunteers that have been serving all the way even before COVID and since, just because everyone's been working really hard, and we often don't get a chance to see each other. So it was really nice gathering. It was Friday and it was beautiful. We're outside under a tent, so it felt safe. Some people aren't vaccinated, but it felt safe to be in that situation. So yeah.
Thank you. Who else would like to share an update?
I will. Here in Poultney at Young at Heart, we had a volunteer appreciation picnic Monday this week. And it was a grand success. We had 60 people. So it was like 30 of the volunteers that come every week and got us through this pandemic. And the Meals on Wheels were always delivered. The drivers, everybody came. And we had a grant for entertainment. So I used some of that money to have it catered so that none of the volunteers had to work. And we had volunteers, musicians come, and it was outside, and it was a lovely day. And then, of course, the Council on Aging said to us that today we had starting September 1st, we have to wear masks again inside the building for protection and mandatory. So I put the signs up on the door, but nobody bucked it really. You know, they just said, okay, we saw it coming, the schools and this and that. But if it's the same group that have been together, 5 or 6 people playing cards, they wear it coming in, they're not wearing it. Why they play cards or do their bone buildings. Anybody new comes in the mix, then they all talked about it, and then they would put their mask again on for 2 weeks. But I'm afraid that I might lose volunteers because some of our people here in Poultney don't want to wear masks. They've been vaccinated. They believe in the vaccination. We hardly have anybody that hasn't had a vaccination. So if it goes beyond the 2 weeks of wearing the mask, I might lose some volunteers. And, you know, we're actually fully open, and they all happy. They don't want to change.
I just want to add that Danville is in the basement of a church. We rent from the church, and there's been a little bit of push and pull about whether we can put a sign on the door. Since there's not an emergency mandate, one of the church members had issue with us putting a sign up about even the recommendation to wear a mask. And we made a mask available on the inside of the door. People could take them if they wanted. So that was another factor in deciding to close. It's like we couldn't even advertise what was recommended. So we decided, oh, just make it simple and we'll just close for now. We're only getting like, I don't know, 6 to 8 people, which and like 20, 25 we had been getting. So it wasn't like we were turning away people. Most of them get takeout anyway. So
I have a question in regards to masks for Meals on Wheels delivery folks. What's the recommendation there?
So again, there's no mandate for people to wear masks, right? But it's highly encouraged to mask up when indoors. So if the Meals on Wheels volunteer is going into the home, the recommendation would be, they would be encouraged to wear their mask when in close contact to a participant or going into the home of a participant.
Hello, Kathy Templin here, and I represent the Community Senior Center of Richmond, Huntington, and Bolton. And we don't have our own physical centers, so we utilize the library and the churches in town. And we have just this week made the decision that masks are going to be necessary in all activities that are sponsored by the senior center that are inside. And we're discontinuing the food at our coffee hour. And those are just the decisions that we've made in regards to the safety with the Delta variant at this time. So it's kind of a step back, but we feel necessary at this moment.
Thank you for sharing an update. It's good to see you. How about Joanne or Rebecca or Marianne? Anybody else like to share an update?
We've been in Castleton, we've been very fortunate in that every one of our programs are up and running right now. The only thing that isn't is our senior meal program, where we were serving senior meals Monday, Tuesday, and Wednesday. But some of that has to do with the fact that our kitchen manager had surgery and is not able to come back yet. Our goal is to have those programs back in October as well. We've encouraged just about every one of our we have encouraged all of our exercise classes to meet in the van shelter outside. So that pretty much takes care of the concern about the masks. The only group that seems to meet that I would say would be more than just a handful of people is our coffee hour. And we have such a loyal coffee hour group. They just couldn't wait to get back together again. It's such a social event for them. And we were kind of feeling uncomfortable with them being together and sharing their coffee and sharing some pastries and so forth, until we noticed that several of them were wearing masks on their own. And they felt that, for whatever reasons, whether they had a couple of them, had family members who might have been compromised. So they felt it was important for them to wear a mask. And I think that that's great that they took that responsibility themselves. A couple of our members who were coming to a sewing group stopped coming because they are taking care of very young grandchildren. And they felt it was not good for them to be in a situation where they might be exposed and therefore take that home to the grandchildren. So I just feel this sense of responsibility that our members are taking it upon themselves to do this. As I've shopped this past week, I've taken my mask and I've worn it in several places because I see so many more people are wearing masks at the grocery store, or at the hardware store, or wherever. So we feel like we just, are saying a prayer and keeping our fingers crossed and doing everything, lighting candles and doing all of those things to hope that that we're able to continue at least the way we are now. We were able, because we weren't able to do our senior meals, I think I mentioned this in another meeting, we went to a picnic on the lawn. And so it was all outside. It's once a month. And it's been extremely successful. Of course, some of that has to do with the fact that we have our ukulele group, and the ukulele group comes and plays songs and everybody sings along. And we had, I think the smallest group was 55 and the largest one was 90. They bring their lawn chairs and they sit out on the lawn and they sing, and the meals are packaged by our food service. We have our catering service do all of our meals. And it was packaged so that everything came in a little brown bag. And they would they come up and pick up their brown bag and go to their seat and sing along. And it's just been so rewarding to be able to offer some of these programs. I don't look forward to the cold weather and what that might do to some of our programs. But when it was cold in February and March, we did do grab and go meals. And we again had 50, 60 people coming for the meal. But what they all said was, we really want to socialize. We really want to be able to see our friends and talk. And that's what made the picnic lunches so successful, because people could actually talk with their friends and be outside and feel safe. So we just keep our fingers crossed and hope that maybe, come October, we'll be able to go back to our senior meals. They'll have to be probably the social distancing and prepackaged meals, but we just hope and pray that things don't deteriorate, because we're happy with the way it is right now.
One thing we're attempting as much as possible is hybrid things. So even if we have a program here, we're also offering it virtually so that we can keep the numbers down here a little bit, and people that want to stay home can stay home. So wherever possible, we're doing that, and still offering the takeout meals. But the numbers in the dining room have been a little bit lower, except for some special meals that I guess people just love and can't stay away from. They don't mind coming into a group if it's Reuben's or meatloaf. They'll be in a big group, but otherwise they're a little bit smaller groups. But other updates?
Marianne here. We're plugging along. The only concern I have is our bingo, because that's the only group that we have that we are, that we know may possibly have someone that's unvaccinated. All of our other groups, before I knew any better, I asked everybody for their card to be in a card carrying vaccinated person to come into any of our groups, and those groups significantly have not changed. The only worry I have is our bingo, and it's grown extensively. Where we used to have 18 or 20 people, we have 35 or 40 people now. And that is a concern. We have heard of no cases, so there should there need not be any contact tracing or that type of thing. But other than that, I do agree with you, Deanna. Our group have, at first, when we opened up for congregate meals, we were packed, not packed, but packed for COVID times, it was maybe 15 or 20 people. And now we're down to 4 or 6 people that come. And I think they're all concerned again about the Delta variant. I don't know, I do have my mask mandated signs out. If you're unvaccinated, you need to wear a mask at all times in the building. I don't have a problem with that with our tag sales. The people, you know, I just have somebody at the door saying, well, if you're not fully vaccinated, here's a mask for you. But I dare not do that at bingo. So I don't know how to deal with that. As I knock on wood here, we had no problem so far. I don't want to, but if anybody's got any suggestions, I suppose I could stand somebody at the door with a mask in hand, but I don't really run the bingo myself. One of my one of my trustees runs it, and I can ask her to do that if you feel that, you know, needs to be done. So what do you think, Angela?
Good question. I'm not a public health expert, so I'm really just trying to convey the message from the health experts here. I would, again, you're an independent organization, right? As a senior center, so you certainly can require masks of people coming into your building, to your programs. That's a choice that you can make as a senior center. And I think reinforcing the Commissioner of Health's recommendation that people, the encouragement to mask indoors during this time of a high surge is, you know, that's another way. So if you can potentially maybe put more signage up to that effect, really encouraging that. Having masks available at the door is another way to just reinforce that message. And then it can be kind of, hopefully as more people mask indoors too during this time, I think it becomes more, you know, seen as more common and just what we do. We all got used to it last year. So I think it's just kind of regrouping during this time. Hopefully, you know, the projections are that cases are going to decline this fall. So if that stays true, then we hopefully will be in a better place in a couple of months.
Yeah. That's our experience here too. We've decided not to make masks indoor mandatory. We're still requiring them for anyone who is unvaccinated, and we're saying they're, you know, optional but recommended. And what I'm finding is people, like Joanne said, are just being very responsible, and the more people that are wearing them indoors, the more it encourages other people to wear them indoors. So if we're doing group activities, you know, staff is greeting people wearing a mask, and then people are just pulling out their masks or grabbing one from the door. But we're not making them mandatory. We've chosen not to do that, but we are in a little bit more of a rural area with fewer cases. But it is encouraging that they're already starting to trend downward, and thinking that should decrease through September and October too. Hopefully that's the case. I'd love any more quick updates, but we're just about out of time, and we are losing a few people that had to go to do other things. So thank you so much to those that are joined but had to jump off. Is there any other updates or burning questions that you'd like to talk about today? Everyone doing okay, hanging in there? Rebecca?
I don't really have an update. I just wanted to say hi to everybody and introduce myself. I'm Rebecca Isham, and I am the new Senior Center Director of South Burlington. So our brand new Senior Center is open. Last week was our very first congregate meal. We had 60 people, and we had our second one today with 30 people. So, just wanted to say hi and introduce myself.
That is wonderful. Welcome. Did you
Thank
do
you.
the survey? No.
I haven't, but I will because I didn't realize there was one.
I'm just teasing. You might not, you might find it difficult. If
No, but I
you don't have a lot of data
what kind
yet.
of what kind of questions you're looking for and that kind of thing. So
Good. So you are on the email list. Did you get my email reminder from today?
yes, I did. I was the one who sent you the email asking about the if there really was a meeting.
Okay, thank you. Good.
It was on my calendar, but I didn't like have a link or anything, so I was confused.
Okay.
Rebecca, I don't know if Dale, if we have your contact information, because we periodically send out information to a large network of folks. And so I want to make sure that we get you on our list
Okay,
as well.
I did attend like the first or second week that I was here, I attended a meeting with Connor. It was a pathways meeting.
Yeah.
Does that sound correct? It was like a path forward, maybe something.
Yeah, the path forward, the facilitated group meeting. Yep.
Okay. I'll touch base with him then. So
Yep. And if he doesn't, just reach out. It's no problem.
Okay. That would be a great update for Connor to share with us at the next meeting too, what's happening with those. And Marianne's comment about bingo growing reminded me about the Guinness World Book of Records bingo game. Marianne, did you see my note about that? Maybe. I can resend it if you'd like. In October.
Yeah.
Did you
I'd
see
like
it?
you to send it to me. I did not see it.
Okay. I think it might even be in the reminder that I sent out today. If you scroll down, there's
Okay.
there was one section in there about that.
Okay, I've been uber busy here, so I didn't really scroll down on that today.
That's all right. Everybody has. I have too. This is really my first day back in the office, so I have that's why I didn't send out the reminder sooner. Thank you all so much. Even though it was really just an update sort of meeting and sharing, it just always feels productive to see each other and hear what's happening and get an update from Dale. So thank you. And thank you, Kathy, from one of our AAAs for checking in and being here too. Anything else from anyone?
I just want to say thanks to everyone, and because when I bring this information back to the board, our board, it's helpful to know what other centers are doing, and it's big help. Thanks.
Good job over there in Ludlow.
Yeah, we're there. We're open.
Good. Anyone else? Thank you all so much. We'll see you next month, the first Wednesday at 2 p.m. And welcome, Rebecca. Bye, everyone. Thank you.